Welcome to Ask Dr. Geier Live. Wherever you're watching, I hope you're making today your masterpiece. It is that time. It's the one time a week I answer questions about orthopedic injuries, surgeries, rehab, recovery, all that kind of good stuff. So I am here as long as you have questions. If we only have a few, it'll be short. If we have a bunch, I'll stay as long as we have them. But I very, very much appreciate it. Moonstar42, happy Friday to you. I hope wherever you are, I hope you have an amazing weekend. Always remember, this is not medical advice. This is meant for general information and educational purposes only. Tony, hello. Good to see you. A new face, I think. I haven't seen you, looked at x-rays, looked at MRIs, haven't examined your knee, shoulder, whatever it is. So this is not medical advice in any way, shape, or form. That's true on the website. That's true on all my videos, but especially in these live shows. But I do want to give you information that hopefully can help you then go to your orthopedic surgeon or go to your doctor and that maybe ask more specific questions. Hey, what about this? Or you just have a better sense of what's going on. All right, Chitra, surgery 84 days back, a lot of pain and limping. Remind me what your injury was. I think you've asked about it before, and I think you are the tibial shaft fracture, but I'm not sure of that. I will answer that for sure. Georgia's good to see you. I would love to be in Greece right now. That sounds amazing. It is funny. I have a lot of friends that have gone to, and family that have gone to Greece this summer. I don't know what has made Greece popular this year. Not that it's not an amazing place. I've never been, but it is interesting that I know so many people that did it. So Chitra, let me know, remind me your injury and I'll address the pain and limping 84 days out. Amit, ACL surgery 6 weeks ago. How long before I can run? So this is, it's a little tricky because ACL surgeries, and this is true with most surgeries, the amount of time out from surgery is one factor, but one very small factor. Typically, it's about 12 weeks, but there's nothing magical about 12 weeks after ACL surgery. It's a matter of having full range of motion of the knee. It's a matter of having as much as possible the strength back, all your quad strength if possible, hamstring and everything else, so you can minimize the microscopic stresses on that ACL with impact. Again, that's typically 12 weeks, but that really depends on how well the rehab is coming along. Yes, he was, or Chitra was the tibial rod. Will you ever forget about this fracture? Can't take my mind off it. Want to be before dancing, carefree, leg hurts. Yeah, this, and this is not, I haven't seen you, so I don't know if this is what's going on, but I would see that occasionally with athletes after, it was usually ACL surgery, but sometimes it was other types of surgeries where they just didn't get their confidence back. They never felt comfortable on it. A lot of times sport-specific physical therapy can help with that because you can recreate the motions that cause people to have trouble. But the flip side of that is occasionally, and this was, to be fair, more for at the high-level athletes, but I'm sure it's true at the high school athletes and everybody else, sometimes a sports psychologist can help get through some of that. I don't know if that's what's going on there. As far as the pain and limping after surgery, yeah, typically by around 3 months, which 84 days is getting close to 3 months, people can walk pain-free because that's about when that fracture tends to be fully healed. Maybe up to 4 months, but that's typically the timeline. Again, it's not the amount of time, it's how much that has healed, and that really depends on the x-rays and people's biology and things like that. Too hot, 42 degrees. I'd have to do the math what that is in our Fahrenheit. But yeah, I bet Greece is one of the best places for a summer holiday. It seems like I missed somebody here. Amit, ACL surgery 6 weeks ago. We did that. I'm able to walk now with some limp. Yeah, that's typically about right. You have to be able to walk without a limp before you can run. But again, that's, again, typically 12 weeks. That doesn't surprise me too much at 6 weeks that you can't run. I would hopefully you'd get to past where you are limping. Again, some of the limping depends on, you got to get full motion back, even just for walking normally, and then get strength of the muscles around the quads. All right. Karanvir, I may have said that wrong. I apologize. Patellar tendonitis for 6 months, not healing quickly, any tips? Yeah, patellar tendonitis is tricky. I mean, you can try short-term avoiding the exercises, the moves that bother it, and a lot of times that works. But if it doesn't, that's tough, and people want to get back to that exercise. There are what are called show pat straps or counterforce straps for the patella tendon that for some people say are helpful. My experience, the basketball and volleyball players did well with those, very few others, but that's anecdotal. But that is sometimes worth trying. You could think regenerative, and obviously, and physical therapy, very, very important. Strengthening the muscles around the knee, the quads especially, but all the stabilizing muscles. Ice to the patella tendon has actually been shown multiple times to be very helpful at relieving it. And then after that, if the traditional things aren't working, there are regenerative things. PRP injections into the patella tendon. I like that better than the sort of the old school prolotherapy with sugar water, but PRP is trying to stimulate an inflammatory reaction and try to get that tendon to heal. There is thought that peptides might work, especially BPC 157. For those of you that are into those types of things, that is thought to be helpful for tendon and ligament injuries as well. So those are some of the things you think about. If you get an MRI and nothing's worked, you get an MRI and you see a small area of degeneration, occasionally there can be indications to go in surgically and cut out the diseased portion of the tendon and then sew the defect back together. That can have good results, but that is really a last resort. You don't want to start with that. All right, let's see. Amit says, I have full extension, not full flexion. Yeah, the full extension is the key one early on after an ACL surgery. You want to really have that back by about 4 weeks, because if you don't have full knee extension, especially 4 or 6 weeks, it's going to be very hard to walk normally going forward. So you want to get that as soon as possible. Yeah, ideally you want to be past 90 or so after 4 to 6 weeks, get up to 110, 120 and beyond. But flexion, in my experience, isn't as critical to get back right away. Tony says, patellar surgery 4 months ago, broke in half, just 2 screws. How often do the screws back out? Keep getting a sharp pain at the top of my kneecap. They don't often back out, but in theory they could if it's just the 2 screws and no what's called tension band wire that sort of compresses it as you put your knee through a range of motion. Without seeing it, I don't know, but if it really is the 2 screws, still not likely, but certainly possible. It also could be not that they're backing out, but they could be just a tad long, which I've seen a few times. And then obviously the one that you kind of want to watch out for at 4 months would just be, did it fully heal? And that would be x-rays and physical exam and all that with your doctor. But those are kind of the common reasons. The other things you could kind of think about, no, it's healing fine. The hardware is in good position. You don't have all the quad strength back, so all the stress is still going to your kneecap, to your patella, and not your quads are not taking up some of that force, and that can be uncomfortable as well. Let's see. Can't get full range of motion. Patellar fractures, open reduction, internal fixation of the patella. It is hard to get motion back. The orthopedic surgeons tend to go fairly slow getting motion back. The longer I'd go faster and faster with the motion because I would want to avoid that circumstance. But you just have to work really, really hard on it. Usually people get full extension, it's getting full flexion back, but that is not uncommon. Physical therapy like crazy, sometimes there can be indications for more, not usually as much at 4 months, but 6 months beyond, sometimes arthroscopic removal of scar tissue, lysis of adhesions, things like that. Amit has nearly 110 degrees of knee flexion at 6 weeks. That's usually pretty good. Obviously, you want to get more than that, but that's not unusual. Unable to climb stairs properly, especially getting down. Knee bending is not. Yeah, and I don't know, Chitra, what's going on in your specific case, but big fan of physical therapy to get strength back and to get people used to and better able to do physical movements that they normally do, whether that's stairs, whether that's walking, whether that's jumping, whether that's landing from jumps, all of that kind of thing. Big fan of physical therapy for that thing. 18HC United. what do you think the percentage of MCL injuries that won't require surgery? Probably 95%, a big majority. Multi-ligament knee injuries, where it's ACL, MCL, PCL, something like that, or grade 3 MCL injuries off the tibia sometimes. Those are typically the ones that don't, and again, that's pretty uncommon. Not impossible. Pains while squatting. How long will it take to heal? That's hard to know. It really depends on what it takes. My thing with patellar tendonitis is maybe not 95%, 85% of people get better very quickly doing just about nothing, or maybe short-term avoiding that activity, or ice, or the counterforce strap. The people that don't, the 15%, can be really tricky. That can be 6 months, it can be longer. And the time is obviously at the time you start treatment, not when it started bothering you. So how far out now? My experience has been the longer people have a problem before they start treating it, the longer it takes to get better. Not just patellar tendonitis. I see that with tennis elbow. I see that with plantar fasciitis. People that come in 6 months, a year, that's going to take a long time to get better. If they come in 6 weeks of pain, tends to be a little bit better. Obviously, you can't go back and fix that now, but just my experience. Tony, you're very welcome. I mean, it is possible to have tendinosis. That would be something you would really see on MRI, but it's certainly possible, especially for these protracted cases. Can't say that in your case, but it's certainly possible. Bina says, cortisone injection in my shoulder last week. Also have tennis elbow. Can I take PRP for it next week? That would be controversial as to the PRP is not controversial. I'm a big fan. Depends on what the problem is. Big fan of PRP for tennis elbow, lateral epicondylitis. Depending on what the shoulder problem is, I'm a big fan of it as well. There is some thought. PRP into cortisone into the shoulder would really have no effect on PRP in the elbow. But if you did PRP into the same joint that you just had cortisone 2 weeks ago, 3 weeks ago, I would worry that would the cortisone would inhibit the action of the PRP. So if it's a PRP injection into the shoulder, my preference would be not to do a cortisone injection really of much of anything for reasons I've talked about before. But certainly would give it, I don't know that there's a right answer. I don't know that it's been studied, but at least 6 weeks, maybe 3 months. I just don't want to waste or negate the effects of the platelet-rich plasma. You are so welcome. I very much appreciate it. Amit, you are welcome too. All right, last call for questions for today. I will put the last questions up there, I will say, or the call for last questions out there. If you would like to see me as a patient, I see patients in Charleston, South Carolina, occasionally see people in Charlotte, North Carolina, but those are really more for North Carolina people. People from out of town, we have come to Charleston. There's a link to my website in the description below, drdavidgeier.com. Go to the Work With Me tab, drops down, you'll see a contact page. Then leave a message with your contact information and what your problem is, and we can potentially work with you to set up coming to Charleston for talking about all sorts of things, not just surgery, not just physical therapy, and not just cortisone. We talk about all kinds of things. Chitra, you are very welcome. Jamie, good to see you. Bina, you are very welcome. I hope all of you have a great weekend. But yeah, like I said, I'm doing very well, Jamie, and really appreciate all of these questions and everybody participating. Remember, I'm here every Friday to answer your questions, and as you can see, some people have been here multiple times, so we're doing follow-ups, but very excited to be here. It is drdavidgeier.com, drdavidgeier. It should be in the description below this. Yeah, I'm doing well. I'm a little tired for a variety of reasons. Stayed up way too late last night watching the NBA draft to see who my Memphis Grizzlies would get. But all in all, a great weekend. Have a fantastic weekend. Stay safe. If it's hot where you are, definitely do your best to not overheat. I hope you have a fantastic week. I will see you Thursday afternoon for Better Than Ever Live, 5 p.m. Eastern Time, and again, 12 p.m. Eastern Time next Friday for Ask Dr. Geier Live. Tony, I will see you next Friday as well. I will see all of you next Friday. Thank you and have a fantastic weekend. Take care.